making a different turn, or are you going to do something totally different this week?
Yeah, so this week we're going to talk about one of the modalities we have here at the clinic, which is the stim machine.
This is one of our stim machines here. We have 3 of them here. This is what we use in the office. We can do lots of different things with it. There's lots of different settings we can do with it. If I hit the button here, we can see we kind of have preset about 8 different presets here that we use, but even with that, we generally only use 3 or 4 of these different settings with it. You know, some such as tennis elbow or shoulder are going to be used the same such of hertz, but generally we use 3 different settings on this machine.
So 3 of the ways that we can use this stim machine is for swelling and some strengthening, as well as IFC. So swelling to start is going to be at a low intensity, so around 1 to 5 hertz. Usually it's only around 1 hertz or less. For swelling, the goal is to just stimulate very low intensity, like the capillaries, to contract a little bit to get some of that swelling and edema to flush out of that area. So that's why that's at a low intensity, because we only want to be working on those capillaries.
Yeah, when you're doing it in such a low current, you won't be feeling a lot. So a lot of times people say turn it up, turn it up, turn it up, but the whole idea is we're working on those small little capillaries around their arteries to make them contract a little bit, so you're really not going to feel too much with it. On the other end, we've got the strengthening, which is a 2500 hertz, so much bigger current. The whole idea with this large current is we're trying to attack the motor end unit in the muscle. So we're actually going up the main nerve that goes to the muscle. What we want to see happen is we want to see the muscle contract. So if you put it on your bicep's going to look like your Popeye coming up. And what happens with this, it's a very large current, and we use it for strengthening. It's on for 10 seconds, off for 50 seconds. So the 10 seconds is a maximal contraction, and we off for 50 seconds. That gives the muscle a chance to re-glycogen, re-energize, and then we contract it again. This was kind of discovered back in the 70s when the East Germans and Russians showed up at the Olympics, and they had these huge muscles all over the place, and a bunch of physios went over to investigate what was going on. They discovered they found this new current. It's really good for strengthening up certain muscles. We find that about 9 treatments of that equals about 6 weeks of weight training.
Yeah, and then the third one is kind of in the middle of those two. So it's what we call IFC, so interferential current. That one does a little bit of everything. So we get a little bit of muscle stimulation, we get a little bit of those capillaries for swelling. And that one's usually between 1 to 150 hertz, but it can go all the way up to like 1000 hertz.
Yeah.
So that one is really common here at the clinic, so that can help reduce pain and just overall feel a little bit better.
Yeah. I know some of you will have your little TENS machines at home, your little stim machines at home. A lot of times these are called TENS machines, so TENS, so trans-electrical neurostimulation. And if you're using that setting, it's more like a numbing effect. It's more of a, if you go to the dentist, you get Novocaine, so you put it on, it kind of numbs the area a little bit. It's really used for chronic pain and a little bit for acute pain. Some of the machines will have something called the EMS side to it. And EMS is more like what we have here with different settings. It's called electrical muscle stimulation. So they may have different settings you can use. It's not going to be as powerful or strong as what we have here, but certainly you can have different settings to do different things like we use here for swelling and some interferential current. But those are things that actually a lot of my patients will use at home if they're really, really sore.
Perfect. So thank you guys for watching this video. Hopefully you kind of understand a little bit more of what's going on when you get this modality and the different ways that it's used. So if you like this video, please leave a like. Don't forget to subscribe, leave a comment if you have any feedback, and as always at Goldsworthy Wellness, we got your back.